Can you tell me your name?
My name is Becky.
And how old are you?
I'm 35.
Where did you grow up?
I grew up in Superior, Wisconsin.
What was your childhood like?
I didn't have the greatest childhood. It was hard. I grew up in an abusive home, and we had some hard times, but overall, I think it ended well.
Do you have any siblings?
I have a brother, Josh, who was adopted. We both were adopted, actually. And I have 4 half-sisters and a half-brother from my birth mom.
Are your parents still alive?
Yep, my parents are still alive.
Are you close to them?
Yeah, I am. We talk a few times a week, and they take the kids a couple of times, well, probably at least once a month, and I'd say I'm close to them, yeah.
Did they support you growing up?
Yes, they are always very supportive of anything that I wanted to do.
Did you have a lot of friends growing up?
I had, I'd say I had more of a few close friends, and then I was just kind of, I don't know, I wasn't an outcast, but I had a few close friends, and then I just kind of hung out with big groups of people. But I was very shy growing up, so it was hard to make a lot of friends.
So what did you want to do when you grew up?
I always wanted to be a veterinarian, but then when I went to school, I didn't want to do all the chemistry, so I changed my mind.
And what do you do now for a living?
I'm a nurse.
How do you like that?
I love it.
How's the pay?
It's pretty good. My first year out of school, it was pretty crappy. I couldn't find a job here in the city, so I had to go outside the city's a little ways, and it wasn't very good. But now it's much better.
What unit or department do you work on?
I work in the NICU, which stands for the Neonatal Intensive Care Unit.
So what does that entail?
We take care of babies who either have been born too early and need to be monitored, and a lot of times they need help breathing. Sometimes we take care of kids who are full term, but they're sick either with some kind of a birth defect or a heart defect. And sometimes we get babies who just aren't really doing well the first few days of life and just need a little help getting over the hump. And
is it difficult taking care of such small babies?
it was more difficult at first because some of them are really tiny, and it's hard you're afraid you're going to break them. But now it's gotten a lot better. I actually feel like I'm making a difference, which is very nice.
Do you ever get attached to certain babies?
Oh yeah, there's a lot of times where the babies are there for months. They're born at 23 weeks gestation, and they're there until they're at least 40 weeks. And so you get attached to the babies and the families, and sometimes it's kind of bittersweet to see them go home.
Do you have any children?
I do. I have 2 kids, 4 and 2, and if they were younger, I don't think I could work in the area that I work at, but they're older now, so that makes it a lot easier.
Can you show me the size of the babies you care for on your unit?
Sure. Some of them, I'd say, are about this big. Actually, they're smaller than this because they're not so filled out. The filling out is not done until the last couple of months inside mom. And so they're about this big. To compare, this is a $5 bill. So they're not much bigger. They usually, when they're born that early, they are usually around 500 grams in weight, which is about a half a kilogram, so about a pound. And these, to compare, are the diapers that the little ones wear, and they're actually usually too big on them.
So what age would that baby be then?
This baby would probably be between 23 and 25 weeks gestation.
And what is a normal gestation of?
40 weeks.
Can you tell me some of your biggest accomplishments?
Well, I'd say finishing nursing school was a big one. It was hard going back to school later in life. So that was definitely a big accomplishment. And then going from the nursing home, and then I worked on an adult med surg floor, and then getting into the NICU, it's usually hard to get into. They don't hire a lot of people very often. People start there and they don't leave. So I feel like it was a big accomplishment getting in there when I did.
Are there any perks as far as being in the NICU?
when I was going to school, I thought that I wanted to be in adult critical care. I wanted to do trauma. It's really difficult to get into that too, to be able to train to do helicopter transport or to go out to the scene of an accident and work on people and bring them back to the hospital. But in the NICU, the one that I work at, it's called the level 4 NICU. They have levels 1, which is a healthy baby nursery that you would have in a normal hospital, and then 2, 3, and then 4. There are very few of them, but we take the sickest babies, and so we take babies from the North Dakota area, South Dakota, Minnesota, Wisconsin, and sometimes we'll take an ambulance and go if they're nearby and stable and transport them. Otherwise, sometimes we get to go in the helicopter and fly out, pick the babies up, and bring them back to us. So that's kind of cool.
Do you have any advice for someone going into this field?
There's probably a lot of advice that I could give. Start young. If it's something you even think you want to do, I'd start right away. The sooner you can get in, it's just the better off you'll be. I would go for your RN, not your LPN, because they're phasing that out a lot. And I would definitely take a year at least to work on a med-surg floor, because you learn a lot. It sucks, and working with adults is not really fun, but you learn a ton and you gain a lot of confidence, and so it's a step that nobody likes to do, but I would definitely do it.
Well, thank you. I appreciate your time.
You're welcome.